Welcome to the Modern AT. This video focuses on Emergency Action Plans, or EAPs, in sports medicine. EAPs are critical, written, and practiced plans that help teams respond quickly and safely to serious or life-threatening emergencies. The purpose is to convert preparation into coordinated action.
Our learning objectives are to define an EAP, identify its components, describe how roles and logistics support rapid response, and apply EAP principles to catastrophic scenarios like sudden cardiac arrest and heat illness. Remember the big idea. A strong EAP is written, shared, practiced, venue-specific, and regularly updated.
An EAP is a rehearsed plan identifying how an organization recognizes, responds to, and follows up after a medical emergency. It matters because emergencies are unpredictable, and a plan reduces confusion and improves response time. The key principle is assign roles and practice the plan before an emergency occurs.
The core components of a strong EAP address practical questions: venue information, emergency personnel and roles, communication systems, emergency equipment, and condition-specific protocols. Finally, rehearsal and review are essential. If a plan doesn't tell people where to go and what to do, it's not ready for game day.
The EAP activation sequence starts with recognition, followed by activating EMS and providing immediate care. Next, retrieve the emergency equipment. Finally, direct transport, manage the scene, and document the event. Assigned roles ensure that multiple critical steps happen quickly and simultaneously.
Venue-specific planning is crucial. Every field, gym, and court needs its own detailed plan. Map essentials include the exact address, EMS entry gate, equipment locations, and where an EMS guide will meet the ambulance. A perfect protocol fails if EMS cannot quickly find the patient.
Clear roles and a chain of command reduce confusion. Key roles include the medical lead, EMS caller, equipment runner, scene manager, EMS guide, and documentation lead. A critical game day reminder is to use closed-loop communication to assign tasks and confirm completion. Emergency equipment must be accessible, maintained, and matched to venue risk. Essential items include an AED, medical kit, cooling supplies, and communication devices. Equipment requires readiness checks. They must be clearly labeled, known by staff, and inspected regularly. An AED locked away is not emergency ready.
Practice makes the plan useful. A medical timeout is a pre-event huddle to confirm the plan. Rehearsals are drills that test roles, response time, and communication. After an event, an after-action review debriefs what worked and what failed. Review the EAP before each season and whenever changes occur.
For sudden cardiac arrest, time is critical. Response priorities include recognizing collapse, immediately activating EMS, and sending for the AED, and beginning high-quality CPR. Apply the AED promptly and continue care until EMS assumes control. The EAP must emphasize AED location, access, and training. For exertional heat illness, rapid recognition and cooling are life-saving. Response priorities are to recognize signs, move the athlete to a safe area, activate EMS, and begin rapid whole-body cooling when indicated. The EAP should define supplies, cooling location, and personnel coordination. In cases of suspected spine injury, priorities include scene control, airway assessment, and stabilizing the athlete while limiting unnecessary movement. Activate EMS and communicate clearly with assisting personnel. The EAP must identify equipment, trained personnel, and sport-specific considerations for immobilization and transfer. The emergency response is not finished until the event is documented and debriefed. An after-action review identifies delays, confusion, and what needs to change in the EAP. Quality improvement turns one emergency response into a safer system for the next athlete. In summary, an EAP is a written, practiced, venue-specific system that enables coordinated patient care. Focus on venue details, assigned roles, condition-specific protocols, and regular practice. Emergency readiness is a clinical, legal, and leadership responsibility. Discover problems during rehearsal, not during a real emergency. These selected references provide foundational guidance for emergency action planning in sports medicine, including NATA and AHA position statements. Emergency decisions should always follow current evidence, institutional policies, medical direction, and local EMS protocols.